Record to the cloud.
Okay,
All right.
great.
And now has everyone seen just my slides in the main screen? Okay,
Mhm.
awesome. All right, well, thanks so much for having me back. It's been a number of years, and it's good to be back presenting with to the Minnesota Lyme Association. Um, the last year of my life has been a little bit more chaotic than normal. So I when I was preparing for tonight, not knowing would the audience be more, would we have physicians in the audience? Would we have mainly patients? Would we have people new to Lyme? It's always hard to kind of know your audience and speak to that because I certainly, it's never my intention to speak over or under anyone. And so it sounds like we have a little bit of a mixed audience tonight. And so I'll do my best. Some of my presentation tonight, I actually presented a very limited part of it. I was honored to be a speaker at the International Lyme and Associated Disease Society conference last November in San Antonio. And that was quite an honor because it was a packed room, people lining the walls with PhDs and MDs on the floor, and I recognized some of the faces, and they had been treating Lyme when I was probably or researching Lyme, and probably when I was in diapers. So that was an honor, an honor to present. But I do think some of the approach I have, I mean, I've been very blessed with good mentors over the years. I've been mentored by physicians both in the United States and in Europe, and very fortunate for those mentors. But I think my background and my background as a naturopathic physician, my approach is actually different. I do actually have something unique in my way of navigating things. So I tried to put that into some of that into my presentation tonight. So I titled my presentation "Beyond the Bugs," because when you get into this space of treating chronic Lyme and chronic infection, you find out it's a really big world, really fast, and it's one of the reasons, frankly, I have sympathy for our conventional colleagues that kind of resist this whole concept because what we're treating is far from just treating infection, you know. So we'll get into that to more detail tonight. So. I include this photo of my three oldest kids because I think they're adorable. No, but all three of these guys, I got Theodora and Xander and Harrison. Um, and by the way, I grew out my hair so I could match them. Um, they all three of them have dealt with multiple tick-borne infections. And I'm very thankful that their father happens to be, that it's not them that got me into this. I was doing this before, but they have all struggled with tick-borne infections. And thankfully, they're doing very well today. Um, but due to diagnostics and mostly natural therapies, thankfully. And this is in one of our favorite places, the North Shore. So I'm not afraid to get into endemic areas and explore the outdoors, but we do try to take precautions. So I'm just trying to minimize this. So chronic Lyme, why it's more than an infection. Um, like I said, it often is infection. It is persisting pathogens, but it's so much more than that. And the chronic symptoms are because of so much more than that. So in the context of these infections, we see immune system dysregulation. We see the mitochondria get impaired. And some of that is actually an intelligent response by the body, so-called cell danger response. We've got a disruption in the whole nervous system. So I list there the autonomic nervous system specifically. Um, and um, and then we've got all kinds of additional burdens from, we are increasingly in a toxic world and a toxic planet, and uh, all of that is weighing on the system. And so and this is not a comprehensive list, but it's just some of the things that come to mind in terms of why this is more than just treating infection. Well, so what happens when the system gets overwhelmed? So the symptoms really are linked to cellular distress. And the chronic illness emerges when the total load on the system, the total stress load from some of the things we talked about, exceeds the system's capacity. And that's when you really see things break down. I firmly believe, and I've seen this clinically, it was some of the really sensitive tests I have, you can have persisting infection and an individual can be just fine. They can be just fine for years, decades sometimes, until they're not. And so it's really important to have that as part of our lens, that this is not, not everyone that's infected absolutely needs the juice poured to them. That's not how it works. We got to consider the whole biology and all the systems. But over time, given the right circumstances, the body will break down when there's too much of a load. So the total load model, and sometimes this is good, and this is not something I invented. I've heard physicians talk about this for years, but you can think of like a cup of water, um, or I might like to think of a cup of coffee or wine, but you got a cup of something, and as long as you keep um, as long as um, the burdens on the system do not fill that cup over and it's not overflowing, you won't have symptoms or breakdown. But that stuff is all there under the surface. And so, we've got chronic pathogens, we've got mold and environmental toxins, mycotoxins, we've got the gut disruption and the permeability, and how central that is to so much um, trauma, chronic stress. I mean, who in our culture isn't burdened somewhat with chronic stress, and how do we set up our lives so that we're not, inundated with extra stress, um, poor sleep, and nutrient depletion, chronic inflammation. So healing really happens when we gradually lower the load and we improve resilience. Um, it's hard for me to say this out loud, but 20 years ago, I graduated from the University of Minnesota. And my major area of study, I was pre-med and studied, my focus was nutrition science. Um, but my minor area of study was the history of medicine, which is fascinating. Oh my goodness. It's just fascinating area of study. But um, uh, one of the fathers of germ theory is Louis Pasteur. And I can never figure out if he actually said this, but it's often perpetuated that he said this on his deathbed. So here, the father of germ theory, or one of the major fathers of germ theory, is saying the microbe is nothing, the terrain is everything. Um, and I bet he said that in French, actually. But anyways, that's what they said he said. And I would say that's an extreme statement. The microbe is not nothing. The microbe creates all kinds of chaos. But it's a good point that it's really about the terrain. It's really about the terrain that gives the microbe so much of its power, or allows it to do as much damage as it can do, as it, So I would say it's both. It's really both. Um, but so killing microbes, just killing bugs isn't enough. killing bugs, if that was enough to recover someone, simply pouring all kinds of antimicrobials at them, whether those be pharmaceuticals, or herbals, or whatever, whatever mechanism you're going to use to kill bugs, that would be enough. But in my clinical experience, it's not enough. It rarely gets someone from sick to well. And part of my message tonight is really a message of hope. I've seen patients in my own practice who have been sick for 30 years go from sick to over years well. So it can happen, but it doesn't happen from pouring the juice to them. So some of these slides may seem too basic, but I think it's getting some of this holistic thinking across that we really have to um, lower the burden, increase resilience across systems. And I truly believe that the body does have an innate capacity to heal. Um, as one of my dear colleagues and friends, Dr. Neil Nathan says, the healing's up to God. I just work here. And the but the system has the capacity to heal. So it's the job of the physician really to identify and remove obstacles and to support the body's innate systems towards health and recovery. Um, so that may sound basic in some respect, but it's quite a bit different actually than the way our um, conventional colleagues, and when I say that, I am not against in any way conventional medicine. I have all the respect for what conventional MDs can be trained to do. But a lot of what they're thinking is based on acute care. It works really well if you get hit by a bus and you need to be saved at an ER, or you have a heart attack. It's phenomenal for that, but a lot of those skills do not translate real well to chronic illness. Um, and so this is actually a different model that the physician's job is to identify and remove obstacles and to support the system's ability to heal. Okay, that's much different than saying you have high blood pressure. I'm going to give you an antihypertensive drug. Problem solved, healing done. Um, so these, I could come up with a lot more pillars, but these are some of the big ones when you think about it in terms of chronic illness. We've got the whole mitochondrial function. And again, the mitochondria, it's not dumb that these become dysfunctional or not even dysfunctional, that they're not working properly. Part of that is an actual intelligent response to the body when it's infected and when it's dialing back the mitochondria and so forth. I won't go into a bunch of detail, but the whole cell danger response of um, but we've got to at some point bring the mitochondria back online. And that's going to affect energy and everything. We've got the whole balance of the immune system. We've got the gut and the microbiome, and of course that's related to several of these other points here. That's related to how the immune system's functioning and how the nervous system's functioning. So these are not distinct entities by any means, but they are major areas that we need to focus on. And then the whole nervous system, especially the autonomic nervous system, you can't heal in that sympathetic state. And then detoxification, and that's important for every one of us, whether we're dealing with tick-borne infections or not. We live in an increasingly toxic environment. I mean, children, before they ever take their first breath, we know from cord blood, they've got glyphosate, Roundup. So before they ever, take a breath or, you know, place a foot on the planet, they are already being bombarded with toxins. And so it's important for all of us really to be supporting detoxification capacity in all the ways that we can do that. So, but generally with patients, when we support all of the pillars, their symptoms improve. Um, So mitochondria, these are, 10th grade biology. These are the energy powerhouses of the cell. It's really important at the cellular, at every cell in the body, but this is incredibly important in terms of chronic fatigue and brain fog. And as I mentioned earlier, chronic infection, chronic inflammation can impair the mitochondrial signaling, and we've got something called cell danger response that I'm not going to go into a lot of detail tonight. But if you're ever, it's a fascinating topic coined by a scientist by the name of Dr. Robert Navio, who is pulling on a bunch of other scientists' work but I think he's the one that actually coined the term cell danger response. But basically, I believe, a very important concept in chronic illness, because you have to get to the point where the cell actually feels safe. Um, and a part of that is comes to treating infection or removing toxins and so forth, and then the healing can happen. But anyways, very fascinating concept. So, and then supporting the mitochondria at some point is really important in healing. But you can't, because of that whole cell danger response aspect, you can't just like, if a patient comes in to see me and they're really, really sick, I can't just support their mitochondria. That's generally not going to work. It's going to backfire. It's not going to do anything, and they might even feel worse. Um, Whereas a pretty healthy person, you can coddle their mitochondria, and all of a sudden they actually feel even better. So what happens with the immune system, without going into immunology in a lot of detail, we can have, these chronic infections can cause the immune system to have a very uncoordinated response. Certain pathways become underactive, other become overactive. It's all confused. There's inflammation, infection is not being controlled. And so part of our job is to gradually restore, a balanced, intelligent immune response. In people who haven't been sick that long, or sometimes like in kiddos that I see, some of this just happens on its own. You get rid of their infections, and it just boom, they're back. But in someone who's been sick for a very long time, um, it's different. Um, so we've got also the gut. So we all know that I imagine we've heard enough that the gut is really the foundation. You talk to anyone in functional medicine, anybody in naturopathic medicine, and the gut is the foundation. It's got to be really, really supported to get someone well. And this has to do with its relationship to, the whole immune system. I mean, 70-80% of the immune system really housed there. And then the nervous system too, the connections with the nervous system. So the gut is really central to healing. Um, and so, dealing with dysbiosis in the gut, imbalance in the gut, treating permeability, chronic permeability, or so-called leaky gut, that's really driving chronic low-grade inflammation. And so, in a sense, you can have inflammation coming from infections, you can have inflammation coming from toxins, you can have inflammation coming from the gut. And symptomatically, they all play in. So you got to deal with all the sources of inflammation. Um, Again, this is very general, but nervous system. So chronic illness will push the nervous system into a sympathetic state, and you cannot heal someone when their system's in a sympathetic state. It's not made for that. Or fight or flight is made from running from a tiger, and that's great when you're running from a tiger. But when you're in that, when the nervous system is in that state all day, every day, that's an impossible situation for healing. And also, patients will have sensitized pain and sensory pathways, so everything's kind of ramped up. Um, so I'm not going to go into this a lot tonight. It's a topic all of its own, but the cool thing about the nervous system that was not as well understood years ago is that it's plastic, meaning it can be modified. And so many of our patients have what's called limbic system. The limbic system's all out of whack, and they're and that can happen because of chronic infection. It can happen because of actual trauma in their life. But when the limbic system isn't working right, it's very possible. It's very impossible to heal. And you'll see that in a patient where you're trying everything and it's not budging. And oftentimes the answer is that they got to get the limbic system working better. And they've got to do some also related, some vagal nerve support. And then they can actually start to heal. This is stuff I was, even in naturopathic med school, we were not taught, really. We were not taught this. But this is, you go on Google or PubMed or ChatGPT, this is grounded in real science. This is not woo-woo stuff. Um, so autonomic nervous system, it plays so many, it's involved in so many aspects of recovery, really. But the bottom line is for healing, we need to shift from threat to repair physiology. That's the bottom line. We need to, that's when the body can heal. Um, the autonomic nervous system, and you can also call this the automatic nervous system. But it influences so many aspects of the immune system as listed here. And so again, the bottom line where that tack is if the autonomic nervous system is stuck in threat mode, the immune system can't regulate. And you'll see this. Patients will flare when there's too much stress, noise, travel, conflict, overstimulation. Um, it's directly linked to the autonomic nervous system. So this may seem like a little bit of a jump, and it is a jump from what we've been talking about, but no presentation of mine is complete without talking a little bit about one of my favorite tests. And um, I don't own stock in this lab. It's transformed my practice in some really cool ways and really helped me to um, navigate some complex cases. And every physician has the tools that work for them over their clinical experience. So even though I get really excited about this, it doesn't mean that it's a useful tool for everyone else. But I have found it to be very helpful in navigating some of these complex cases. So we're talking about the ELISpot or the T cell provocation test. Um, and it really gives in my opinion, a much clearer window into what's going on the ground right now. And let me preface it by saying it's not a perfect test. No testing in Lyme or tick-borne infections is perfect. And I never look at the test. I never let the test override my clinical judgment, but it's there to support. And so a positive test of any kind doesn't indicate that infection is the problem, and a negative test does not rule it out. That's the important thing to know when we're dealing with even some of these better tests that are much better than the routine serologies that you can get from the big box labs. But basically, the ELISpot measures T cell activation. And the ELISpot has its roots in transplant medicine. And so in the United States, it's not used in infectious disease very much. In Europe, yes, it's used more. But it's really, really cool when it's done properly by a good lab. It can show you what the immune system is doing right now. Um, we don't need to go into detail about this. This is a topic I could talk about, for probably 3 hours about all the weaknesses in the traditional testing. But it's important to realize that most of the tests are based on antibodies, the B cell side of the immune system, and that's reflective of exposure, not really current activity. It's more, it shows that you were exposed to that bug. And the caveat too is some of our sickest patients are the ones that are going to they're going to test negative with those tests because of low or inconsistent antibody production, immune system variability, immune suppression and exhaustion, intracellular persistence of these bugs, certain medications like prednisone. How often have many of us physicians that have had someone have big workups done at the Mayo and they're negative and the patient was on prednisone. It suppressed, blunted the whole thing. Um, so anyways, there's a bunch of reasons why the routine tests can be falsely negative. And Dr. Joseph Burrascano, who sometimes does presentations for IGeneX, he does a phenomenal job of talking about some of the weaknesses of the testing. But the bottom line is most of the standard tests, pretty much all of the standard tests, do not measure the cellular immunity against the infection. So some of the direct tests, and I know I'm straying from my slides here, but some of the direct tests like culture or PCR, the issue with Lyme and some of these pathogens is that um, some of these pathogens are not very high in the blood. So the ELISpot can show what's really happening now. It can detect low burden intracellular pathogens. How are we doing on time? I know I need to keep things moving along. One of the coolest cases I ever had where the ELISpot shined was a gentleman who had been sick for 30 years. And this helped me out. He got sick while living in Lyme, Connecticut. And for 30 years, he had wondered if he was infected. And every single time he was tested over the years, conventionally, he was negative, negative, negative. We ran an ELISpot. He was positive for Lyme disease. And that was about 5, 6 years ago. He's much better off today, but he literally got sick in Lyme, Connecticut. So
That's me.
And let's see how. Okay, so one of the cool things about the ELISpot is it can really improve precision and your timing of giving an individual antimicrobials. So, for example, I've had patients where I've had to treat them with the antimicrobials, knock down the infection. Then I get a negative ELISpot, and they're often doing somewhat better, but they say they have persisting other symptoms. Then I go to work on other things that may be driving the chronic symptoms. And then I may retest them again down the road and we'll see this in a case later. They may have a positive ELISpot again, and then they may need more antimicrobials and so forth. So it can help to navigate. So again, just one piece of the puzzle. It doesn't replace clinical judgment. So it's always, you interpret this along the symptoms, the history, the physical exam, other immune markers. So it's just a piece. So it can give us real-time insight into the immune activity, and it really can help bring a little bit of clarity sometimes to navigate some of these difficult clinical decisions. I'm going to fly through these, but One of the cool things about this test, again, these T cells, they are present throughout the whole infectious process. So this will go positive within days of someone being infected, and it can be positive throughout the whole infection, and it will go negative within a couple weeks of the pathogen being um, removed. Um, so um, I'm going to fly through these, but basically Th1 T cells, that's when the immune system is actively fighting the pathogen. And the effector cytokine is what we call interferon gamma. But that's when we see this pattern on an ELI spot, we know the immune system is actively targeting that pathogen. And so as I start to treat a patient, you'll see often that Th1 activity decrease, and the central memory T cells are still there and for surveillance. And this pattern is showing that the infection's improving. And here's checkpoint 3, where we see low Th1 activity, but the central memory T cells are still, seeing the pathogen. And so this is showing the infection's controlled and possibly near clearance. And then ideally, we get where both the Th1 T cells and the central memory T cells are negative. And that's when you're basically done treatment, at least for that time. So again, LA Spot's ideal for tracking progress. Um, and again, it's not perfect. There's so many pathogens out there um, that can be a limiting factor. For example, there's so many species of Babesia and Bartonella and all of that. And so it's not cost effective to be able to check everything. So I try to remember that for every pathogen maybe I identify, um, and this comes from a colleague of mine, Dr. Paul Anderson, but there might be 10 pathogens that you don't know are there. So again, this just shows that the Th1 T cells are there, or sorry, the T cells are there throughout the whole process. And whereas the IgG antibodies, they can be positive months or years after the infection is actually resolved. So we got to stabilize the foundation. Before treating infections, we've got to work on sleep and nutrition and gut and, calming inflammation. Borrelia thrives in an inflammatory environment. So anything we can do to lower that inflammation and improve detox capacity. So creating that strong, robust foundation really sets the stage for treatment and improving treatment tolerance. And this is sometimes a hard conversation to have with a patient, because sometimes they have this idea, they, maybe it's an American idea, but this idea that, we could just race to the end. And the problem is this isn't a sprint. It's oftentimes a marathon. So while the presentation is entitled Beyond the Bugs, I do believe, obviously we need to use antimicrobials. And I'm so thankful in my practice. This was a dream of mine 7, 10 years ago. For most of my career, I've practiced with an MD or in a clinic where we were giving, a fair amount of antibiotics. And it was always a dream of mine, knowing what I knew about the gut and so forth, that we could ideally recover people um, without antibiotics. And of course, I read Buhner and all of the, and Dr. Rawls and, but clinically now I can say with absolute confidence, the majority of my patients are able to recover with herbal therapy. And now we've got some research studies showing that, the herbs actually can, exceed some of the pharmaceuticals quite a bit in their capacity, and I think it has to do with their complexity. They are not they are not so targeted, and they have more complexity to them. And so some of our herbal medicines will not just kill bugs, but they'll modulate the immune system. They'll deal with biofilms. They'll decrease inflammation. They'll support the body's endocrine system and adrenals and all of that. So they're just so cool in what they can all do. So we've got to restore the immune system, and restoring proper immune system function does require treating the bugs. But there's a lot that goes into modulating that immune response for that person to heal more permanently. And we talked about mitochondrial support. So you do need mitochondrial support, but it has to be done at the right time. Simply supporting the mitochondria when someone's stuck in cell danger response is not going to yield you any good results. And detoxification. And so, you know, won't go into details in all the ways we support detoxification, but if you support detoxification, you're not going to have some of these huge Herxheimer reactions or die-off reactions or cytokine inflammatory storms. And then at the bottom here, pace of healing is individual. And this is really important. There is no one size fits all approach here. And that's something I've largely attribute my knowledge around this to my colleague, Dr. Neil Nathan. We've had many, many conversations together, but it's the pace of recovery. It is very individual, and you cannot push someone faster than they can go. It just won't work. And so it requires to be in this field, it requires a lot of patience and a lot of hand holding sometimes and a lot of encouragement, because it can be slow. It can be like watching paint dry. Resetting the nervous system. So, everything from supporting the healing power of the vagal nerve, using herbs to modulate the nervous system, supporting sleep and all the ways in which we do that. So I really believe the nervous system is so important. Getting that sets the stage really for healing to happen. So healing is layered. It's not linear. There and one of the confusing things here is there's no clear roadmap. The order of therapy can vary from one patient to another patient. There's certain themes, or there's certain things that we tend to think of in order. Like we might treat certain pathogens in a certain order, or we may focus on the gut before we do something else. But the concept that this is very, very individualized, and there is no absolute correct order to things. And physicians that will tell you there absolutely is, I think they're limited by their own dogma or view, because I've found that what works in one patient, the opposite works in another patient. So, um, recovery is often very gradual. And I think this is really important concept that I try to share with each of my patients, because it's very, very common for someone, say that I'm treating for 3 months, for them to come back and say, I'm no better. And then I'll ask, well, are you still having headaches every day? Oh, no, maybe twice a month, once a month. What's your pain levels? Is it still, 6 out of 10? Oh, no, and this is human nature. We focus on what hurts, what's not going well. But it's really important to almost journal these symptoms and see, because the recovery is very slow, but oftentimes, again, in kiddos, sometimes it's a much faster in my experience, but in someone who's been sick for years, it can be quite slow at first. But most of my patients with tick-borne infections, you're definitely seeing clear improvement in the first, say, 4 months. So again, the heart of the message, go beyond the bugs, support the whole system. Let's see, do we have time here for a quick case? I think so. So this is a case I presented at ILADS last year. So this was a 6-year-old boy with Lyme and Bartonella. And so he presented to my clinic in June of, I'm sorry, no, he got sick in June of 2021 and had severe knee pain, so much so that he couldn't walk. Thankfully, this is kind of rare, but Lyme testing at Children's Hospital was positive. And he was treated with 28 days of antibiotics, and his fatigue and knee pain resolved. His parents had reported a week of Bell's palsy during the initial illness, and then he started getting hip pain, particularly when he was buckled in the back seat of the car. And by the time he presented to my clinic in August, he was basically asymptomatic, with the exception of the episodic hip pain. And I remember I don't have this in here, but I remember his father talking about some um, uh, some cognitive stuff that he was concerned about the way the boy was presenting. And so this is his initial T cell testing or ELISpot testing that I did that showed clear Bartonella and Borrelia. And don't worry about the numbers and so forth. And I know that probably doesn't mean much, but red is positive and yellow is borderline. But we saw a clear pattern of Borrelia, Lyme, and Bartonella Hensley. And so my initial treatment plan was botanical antimicrobials and nutritional support and collagen support. And just, he was doing pretty darn well, frankly, at this point. So I was more conservative with how we started treatment. About a month into the treatment, he had a big flare in his joint pain, but there was a virus going through the family. And this is an important thing, especially this time of the year as we head into cold flu season, when you're working with someone with a chronic complex illness and infections. It's important not to too quickly pivot your treatment plan because of a flare, because the flare can be due to other pathogens circulating. And if you start changing your treatment plan just because things got worse, you're likely not going to make a whole lot of progress. But at this point, we did talk about if he keeps getting worse, yeah, we could switch to antibiotics or a different treatment plan if the trend continues down a bad direction. At 5 months, he was doing well overall. He had a minor flare again with a strep infection. He had a suboptimal vitamin D. We increased that, so forth. And then here you can see his follow-up ELISpot. So this is basically, 5 months into treatment. We're seeing resolving levels on the ELISpot. And then, yeah, so that was like, wait a second, where's my timing here? Okay. So yeah, this is 5 months into treatment, and this is more like 9 months into treatment. We have a completely negative ELISpot for Borrelia and Bartonella Hensley. And so at that time, I had the conversation, it may be premature to stop. Sometimes I like to treat a little bit further past that negative. But he was asymptomatic. And so We discussed stopping treatment, both, it's always just hassle with a kid to have them swallowing capsules and stuff, and then cost and so forth. But regardless, we decided, and his parents were very proactive, that we were going to uh, retest in about 6 months, and just see if we were keeping the lid on things. So this is July. He had a major relapse in the fall, significant clinical regression. Some of these things were things we were not seeing when he presented to the clinic initially, actually. So rage episodes, self-injurious behavior, violent outbursts. So this was quite ramped up behavior from what the parents were reporting initially. And then joint pains had returned. And so this is at this time, you see Lyme's positive and Bartonella is basically positive. It's right on the threshold. And so, this led to a broader discussion of what else is going on with this child's immune system and what other burdens might there be that we could be working on. And we ended up finding he had markedly elevated mycotoxins, and this is not common. And so I believe that toxic burden allowed, Borrelia and Bartonella, for them to really rear their head again. And also that was in this case, we had, even though he's a kiddo, he recovered remarkably fast, that even I was suspicious that even though the LE spot was negative, he probably needs longer support. I included this photo here. I was presenting to physicians out in New Hampshire in May, and I was sitting in my hotel room wishing I had an illustration of what it feels like to treat some of these pathogens and how it feels like you're playing whack-a-mole. And you get one under control and the other rears its head. And this was apparently AI's representation of me. I love the beat of sweat. But anyways, that's what it feels like. Sometimes that you're playing whack-a-mole, but eventually you get there. So 5 core takeaways. Your symptoms are not random. They're either due to the physiology. There's a root cause behind it. Chronic Lyme is not just infection, it's a systems issue, and we got to address all the systems. Supporting the system first generally leads to better treatment tolerance in terms of giving antimicrobials and so forth. Stabilizing the system is not delaying treatment, it's really improving it. Again, that whole idea that this isn't a sprint, it's a marathon. So you can treat the infection when the system's ready for you to do so. LE spot gives us real-time clarity that other Lyme diagnostics tests, in my opinion, cannot. And again, it's really important to realize that even the LE spot is not perfect. It's not perfectly sensitive, but it's another tool. And it can help us determine when to start or resume antimicrobials. So recovery is achievable. And that's my message always with my patients is there is hope. And I can say that confidently because I've seen it over and over. That when you take away obstacles and you support the body, healing can happen. And it's very important that we do not get tied to our dogma of, oh, this patient is sick from Lyme, or this patient is sick from this, or these are all labels. And it's really important for us to rise above the labels, because just labeling stuff, it can often actually lead you quite a bit astray. So your body has a path forward. Healing happens when we work with our physiology, not against it. I can't tell you how many times in my clinical practice where simply, listening to a patient and me believing their symptoms and their story, that's healing in and of itself. I've had numerous patients just break down in tears saying that's the first time I was ever listened to. Um, and so, but these symptoms are rooted in actual physiology. They make sense to me. I don't always know what's causing it, but I understand a lot of the physiology and the connections and the interrelationships. And so when someone comes to me and they've got all kinds of pain and all kinds of neurological problems and all kinds of joint pain and all, there's a reason there. This person's not crazy. This is my youngest guy, Axel, and this is a public service announcement. So even though we were camping along the St. Croix this summer, you could always do tick checks, even if it requires bathing in the St. Croix. So do your tick checks. Um, I've always appreciated the author C.S. Lewis, and here's a quote: "There are far, far better things ahead than any we leave behind." And I was recently reminded by someone that of a quote that I didn't even realize I say all the time, but I've often told patients, your best days are ahead of you. And we need that hope of that healing um, is possible. And I'm not just saying that to patients. I really believe that everyone can heal, and that what that healing looks like is going to vary from person to person, but there's always room for healing and for better days ahead. And then I included this here for anyone who'd like to keep in touch with me, who maybe doesn't receive emails or contact from me, who'd like to. Um, you can take a picture of that QR code or visit that and be added to an email list. And um, I will try to not bombard you with information, but share with things as I continue to learn and grow. And that is my presentation.
Dr. Otten, are you up for a couple questions?
Sure.
So we have a couple questions in the chat. The first one is, do you have any suggestions for getting the limbic system calmed down?
Yeah. Um, no, that's great. Some of these, Kurt, is there a way I can pull up the chat, or maybe I don't need to?
You should be able to if you go down to the bottom
Oh, here
window
we
where
go.
it says chat. Yeah.
Okay. Um, so one of the I don't know how many of you are familiar with Dr. Eric Gordon, but he's a colleague I really appreciate. He practices out in the Bay Area. And he's been in treating complex chronic illness since like the 70s. And he's a youthful guy. I mean, he's youthful in his energy and he's a lot of fun. But I recently heard an interview with him. But he was talking about that. And that's one of the challenges with some of this stuff is what works for one person does not work for someone else. And what I mean by that is there are, so for example, there's programs for retraining the limbic system. Some big ones out there are, Annie Hopper's retrainthebrain.com or the DNRS program. There's the Gupta program. There's others. But there are also things that universally help, like one of my very favorite, one of the things that helps me calm my nervous system. I did it actually before I went on, I went for a hike in the woods after leaving the clinic and coming to present tonight. But that, spending time in nature is almost universally, um, calming to the system. And so while I'm not talking about specifically limbic system retraining, that my point being that what works for one individual is not going to work well for someone else. You know, for one individual, prayer might be helpful to them or meditation, and for someone else, meditation might cause more more stress. So that whole area is something I would love to I would love to go to a week-long conference on just that, because I think the tools that are out there, you know, again, that idea of individuality, that will what will work for one person isn't going to work for another person. But that said, I've seen patients really helped by some of those limbic system programs that are out there. I just wish more of them were free or more economical. So,
Is the next question is there a lab you prefer for the LE spot?
yes, hands down. I think the best one in the United States, it was started in Germany. I actually visited the German counterpart of it in 2019, right before the pandemic. But the best one, in my opinion, is Infectolab, which is now iLab. And I know the PhD, Felix Schultz, who runs it now. But because of, and a lot of this, I won't go into detail, but antigen selection and so forth, they do the best job of the LE spot, in my opinion, in the United States. And they're, for anyone who doesn't know, they're actually in our backyard. They're in their laboratories in the old 3M building here. So
Next question is the child story you shared is exactly what my child, now 28, has been through. Any suggestions for an individual with rage and all sorts of Lyme-Bartonella symptoms who refuses help?
um, hmm, that's a really tough. You know, this is something my heart goes out to whoever. That's a very challenging particular situation, and what I mean by that is when someone is not ready or in the position to heal, or I've seen this where parents, for example, will drag a child in to be seen by me. Oh, they'll pay for everything, they'll do everything, and it's coming from love of that parent towards that child, for example. And but until that individual is at the point, it you don't make any headway. And that's a devastating truth that I wish there was a better answer for, because sometimes the reason that person isn't seeking care is because of how sick they actually are. Um, but maybe one of the other physicians in the audience can help me out. That's a tough one. Um, I remember I um I'm blanking on the physician's name. It's not Sidney Baker, but he practiced in New York also. But I remember hearing him talk at a food as medicine conference I went to in 2003. And I remember him saying sometimes the sad truth is a patient has to get so sick before they'll do anything to heal. But it's difficult when the actual illness is like some of these infections is creating mental illness in a person. Um, that's really, really challenging. So sorry, I don't feel like I answered that real great. Any other questions?
There is a comment from Dr. Verkota. Um, and Dr. Verkota, I'm not going to try to pronounce that. It's a Hawaiian word, ho'opono, and okay, I'm sorry. is a way to calm the limbic system, a Hawaiian way of apologizing to the body for all the suffering it is going through. Saying I'm sorry to the body, say it over and over to your body, to your heart, to your lungs and throat, immune system and vascular system and nervous system and all cells, and mean it. I'm sorry. Please forgive me. Thank you. I love you. So one suggestion for calming the limbic system from Dr. Vakota. Um, and then another question, do you have suggestions for helping mitochondria?
Yeah, I mean, there's a lot of different therapies out there, in functional medicine, and we tend to think of the nutritional support for the mitochondria. So, everything from carnitine to CoQ10 to um, B vitamins, but all the things that will support the mitochondria. So that can be helpful at the right time. I also believe in a lot of, uh, you know, um, and not believe, but there's scientific evidence for, photobiomodulation, red light therapy, pulsed electromagnetic field therapy. So certain energy therapies can really, really help bring the mitochondria back online too. But those are three that come to my mind: nutritional, um, light therapy, and pulsed electromagnetic field therapy. And I'm sure
There's a
Dr.
Go ahead.
Dr. Verkota and Dr. Radovsky probably have some other favorites, I imagine. Go ahead.
So there's another comment. This is to Amy, the person whose child has had troubles with Lyme and Bartonella, from Bill. Um, you may want to chat with Bill. He's offering to chat with your son if he thinks that'd be helpful. Bill has been through some of the same stuff. So Amy, check out the chat and give Bill a holler if you're interested in going there. Are there any other questions that people would like? Thank you, Amy.
I hope this was beneficial.
It's always interesting to chat with you, Dr. Otten. Thank you. Thank you for coming and learn some new
Thank you.
stuff. I've been chatting with you for about 4 years now. So yeah.
Well, thank you. Anything else?
I think maybe it's time for us to go on with our lives, eh?
All right. Well, everyone, thanks so much and have a wonderful evening.
Thank you,
Thank
Dr.
you.
Otten.
Thank you.
You're
Thank
welcome.
you.
And do you want to stop the recording?
Sure.
All right. Good night.
Yep.
Good night. Thank you
Good night,
again.
everybody.
You will. Well, the recording's off, so people can say what they really think.
I was just looking at the chat if there's anything.
Amy, I see that you're still on. Oh, Bill is still on. Did you guys connect and give each other contact info?
Yeah, I sent my email address and I think she just sent me back her phone number, so I'll just reach out via text.
Good.
Thank you.
See you,
Thank
Bill.
you very much.
Good luck, Amy.
Thank
Thanks,
you.
Bill.
Thanks, Dr. Otten. That was really interesting and hopeful. Thanks.
Thanks, Brett. All right. Have a good evening, everyone.
You
And I
too.
signed up for your emails now during your talk. So
Thank you.
I'll be looking for that news that you.
Well,
Yeah.
hopefully my landing page worked. All
Okay. Thank you.
right. All right.
Good night.
Good night.